Good evening. Myself Pratish Narayan from OET4U. So, welcome back to our channel, and today we are going to discuss about writing an effective first body paragraph in OET writing. Okay, with evaluation criteria. So, you all know that to write an effective paragraph is very important in OET writing. So today for that, writing an effective first body paragraph, you need some techniques. So that techniques we're gonna discuss in this video shortly. Okay. So for that, you have to identify relevant, irrelevant, and semi-relevant details in the case notes. For that's the just guide for writing the body paragraph in your writing OET exam. Okay, let's see how we can identify this relevant, irrelevant, and semi-relevant details in case notes. Okay, so all right, for that, understanding the relevance in OET writing, how you think which data or which information is relevant and which information is irrelevant and semi-relevant. So you have to identify these three things as soon as you go to case note. So previous videos we discussed about how to write an introduction, and from that video you can understand how to write an introduction clearly with for that what are the informations you require and what are the key informations need to write a good introduction. So in this video we're going to discuss about how these informations are relevant to write a good paragraph. Okay, so the relevancy of information, if it is very relevant, you have it is directly related to the patient's current condition and the recipient's role. Okay, so when the patients, we will discuss that one by one in each slide later. Okay, so irrelevance is not useful for the recipient or unrelated to the medical issue, and semi-relevant is may provide context but is not essential for immediate action. So these are the three things you have to identify. So how to identify relevant information? So that is the key thing. So if you identify the relevant information from the case note, then your job is almost half done. So that's what you have to ask these three questions to each and every information in the case note. Does the recipient need this information to proceed with care? If yes, include it in the body paragraph. Okay, again, does it affect the patient's treatment, condition, or follow-up? If yes, then include in the body paragraph. That's why it is relevant to the letter. Okay, is it essential for understanding the urgency or complexity of the case? If yes, you should include that in the body paragraph. So these three questions, which is very important, you can to identify relevant information from a case note. Okay, let's see how you can do the irrelevant information. This is not important, but still, in writing criteria, so avoiding irrelevant information gives you some points ahead of other students. So this is very important as well. So social or family history with no impact on treatment can avoid. Okay, so if no impact, then you can exclude that information from the letter. Okay, so minor past conditions that do not affect the current issue. So this is also another thing. And routine test results if they are within normal limits. Some of the tests are given, but if that is within the normal limits, you don't need to include that information in the letter. So these informations we can consider as irrelevant information. Okay, let's see what is semi-relevant. So handling semi-relevant information, so identifying semi-relevant information. Semi-relevant informations are background details that provide context but are not that much important, that not that much crucial. Okay, like past medical history, relevant only if it affects current care. Okay, there are examples that we can discuss later. And social or lifestyle factors that influence treatment decisions. Okay, so only use semi-relevant informations if it helps the recipient understand the situation better. Okay, if it's making any unclear, means like the sentence unclear, you can avoid the semi-relevant informations in your letter. Okay, let's go with an example. So example, the case notes breakdowns. Just see, usually a case notes have the informations like patient's name and age and what is the primary medical condition of the patient, primary or presenting complaint of the patient. So here it is type 2 diabetes, poor diet, food ulcer. And the second um, information says that he plays golf weekly, no family history of diabetes, food ulcer worsening despite antibiotics. In this you can see that, see, relevant information, diabetes, food ulcer worsening. You can see that type 2 diabetes is the primary condition of the patient that is directly related to the food ulcer worsening. Okay, so that is why you have to identify which is relevant to the writing the letter. Again, irrelevant informations like playing golf and no family history is not to have any impact on the letter. Okay, so this is the way you can identify relevant, irrelevant and semi-relevant informations for your letter. Okay, let's move on to the next topic, that the purpose of the first body paragraph. You know, as soon as you write the introduction, you have to draft the first body paragraph, and there are so many different structure you can use for your first body paragraph, but we will discuss that in a different video. But here we're going to discuss about the purpose of the first body paragraph. Okay, so that means the first body paragraph, you already said something about the patient's condition in the introduction itself, but you have to introduces the main issue or condition of the patient in a detailed manner and provides relevant details from the case note, and use always clear, formal and professional language, and demonstrate clinical communication skill for writing the body paragraph. This is the purpose of the first body paragraph. Okay, so how we can write it? So the structure of the first body paragraph, the first should be, you have to write a topic sentence, introduces the patient's main issue. We already said one time about the patient's present complaint in the introduction, but you have to paraphrase and rewrite the same sentence or same condition of the patient with the introduce again to the main issue. Then you include as the key details as the second point, like include the essential clinical informations like diagnosis, symptoms, history. Okay, and next you can write about the relevant background, provide necessary details for the recipient, and if any request or action, you can mention that urgent need of care as the next steps in your end of the paragraph. This should be just a structure. There are different structures, but this will give you an idea to start with the paragraph writing, and you can improve from that onwards, from that point onwards. Like, if you make a draft with these things, then you can go to the sentence structure and paragraph structure later onwards. Okay, so move on to the next thing. So you can see an example paragraph. You can say Mr. James Carter. I would avoid this the age again in the paragraph, because you don't need to repeat the informations in your first paragraph again. So if you didn't mention, you can mention the age of the patient as well. Was diagnosed with uncontrolled hypertension and type 2 diabetes. So that means we are restating or paraphrasing the main condition of the patient in the first sentence. Then again we're going to discuss about more detail about what is the symptoms or diagnosis or other things in the later sentences, like despite medication adherence, his blood pressure remains elevated. That is directly related to the uncontrolled hypertension, and again he has been experiencing frequent dizziness as other symptoms, associated symptoms of hypertension. Then again, his blood sugar levels have also been fluctuating. So that information, you can see that that is you can see a connection between the sentences, because you already mentioned that uncontrolled hypertension and type 2 diabetes in the first sentence, and in the following sentence we are just connecting each other with one by one. Like you can see, the blood sugar levels is directly connected to the type 2 diabetes. So given his history of non-compliance with dietary recommendations, ongoing monitoring and dietary counseling are recommended to improve his condition. Okay, so just go back to okay, that's good. All right, so ongoing monitoring and dietary counseling are recommended to improve his condition. All right, so we'll see what are the evaluation criteria. So always this evaluation criteria um, is very important while you are writing your letter, because this is OET evaluation criteria that you can find from OET official website, and Google it, just to let you know that the purpose, content, conciseness and clarity, and general style, organizational layout, these five important criteria is usually very very important while you are writing your first body paragraph. Okay, so final tips. So just focus on what the recipient needs to take action, and again, avoid unnecessary details that do not impact care. Use semi-relevant details only when they are add clarity. If they is the sentence is not clear with that semi-relevant information, adding that to the letter is going to reduce your score. So this better to if the semi-relevant information gives clarity to the letter, then you can add it. Okay, so and finally, keep the paragraph clear, concise and well structured. I hope you understand what we discussed today, and you can identify these relevant, irrelevant and semi-relevant informations from a case note. Practice that technique first, then you make a note of this, like you can just tick the relevant informations or cross the irrelevant informations, or make some other marks for the semi-relevant informations from the case note, and make it a habit, and then you can write a paragraph, and with a structure that we discussed already. And there is more about paragraph writing that we will discuss in the next video. And thank you for watching the video, and please subscribe and share OET4E channel. Thank you.